Leprosy. Now, there's a word that for most of us probably feels like it belongs in an ancient history book, right? But what if I told you the disease is not only still with us, but it's completely, and I mean completely, curable? Okay, let's dive into this incredibly misunderstood condition and start separating centuries of fear from modern medical fact.
Seriously, just take a second. When you hear that word, what's the first image that pops into your head? For a lot of people, it's probably something out of a historical movie. You know, images of total isolation, forgotten colonies, maybe even the idea that it was some kind of curse.
And that's really the heart of the problem here. For thousands of years, the social stigma surrounding leprosy has often been way more devastating than the disease itself. But today, we're going to start dismantling that stigma by really understanding the science behind it.
So let's get into the science. We're going to peel back all those layers of myth and meet the actual culprit behind this disease. And spoiler alert, it is not a curse. It's something much, much smaller.
Okay, so here's what we're actually talking about. Leprosy, which is also known as Hansen's disease, is a chronic infectious disease. Now, it's slow and it's progressive, but I want you to focus on that one word, right there in all caps, curable. That is the single most important fact you need to know.
And here it is. This is the microscopic organism at the center of it all, Mycobacterium leprae. It's a type of bacteria that was discovered way back in 1873 by a scientist named Gerhard Hansen. This little rod-shaped bug is the one and only cause of the disease.
So how does it actually get from one person to another? Well, first off, it is not through casual touch. That's probably the biggest misconception out there. The bacteria are mainly spread through respiratory droplets. So an infected person discharges the bacilli, say from a sneeze, and then someone else inhales them. From the lungs, they hitch a ride in the bloodstream and find their favorite place to set up shop, our skin, and most importantly, our peripheral nerves.
And this right here, this gets to the absolute core of the problem. See, M. lepra has this unique and pretty destructive talent for invading what are called Schwann cells. Think of Schwann cells as the protective insulation around our nerve fibers. By hijacking these cells, the bacteria causes nerve damage. And that damage is what leads to the loss of feeling and muscle weakness that are the real hallmarks of the disease.
Now, what's really fascinating here is that not everyone who gets exposed to the bacteria actually gets sick. And even for those who do, the symptoms can look totally different. It really all boils down to how an individual's immune system responds to the invasion.
So it helps to think of leprosy as a spectrum with two opposite ends. On one side, you've got tuberculoid leprosy. This is what happens in people with a really strong immune response. They'll have just a few skin lesions, and you'll find very few bacteria in their body. But on the other end of that spectrum is lepromatous leprosy. This happens when the immune system is weaker, and the bacteria can multiply like crazy, which leads to widespread nodules on the skin.
And you can literally see this difference on the skin. On the left, a tuberculoid case might just have a few distinct patches. Compare that to the image on the right, which shows a lepromatous case with those widespread symmetrical bumps. It's the exact same bacteria causing both, just two totally different reactions from the body.
So across this whole spectrum, what are the common signs? Well, it often starts with faded skin patches that have lost sensation. Because the nerves are damaged, a person might not feel heat or touch or even pain in that area. This is really dangerous because it can lead to things like painless ulcers, especially on the feet, and other visible signs like nodules and swelling. You know, one of the most classic telltale signs is the loss of eyebrows or eyelashes. This happens when the bacteria attack the nerves in the face. It's a perfect example of how that internal nerve damage shows up in a very visible external way. Okay, so we've seen the problem, we've seen how this bacteria works, but now let's talk about the most important part of this story, the solution. Because there is a clear, effective, and complete path to recovery that literally rebuilds lives.
Let's just put this front and center, because I can't say it enough. Leprosy is curable. A course of what's called multi-drug therapy, usually lasting 6 months to a year, completely kills the bacteria and stops the disease cold. And get this, the medicine is so effective that patients are no longer infectious after just a few days of starting treatment. But curing the infection is really only half the battle. That nerve damage can leave behind lasting effects. And that's where occupational therapy becomes absolutely essential. The goal isn't just to heal the body, but to help a person completely regain their life. We're talking about everything from counseling to fight self-stigma, to training them how to live safely with hands or feet that may have gone numb.
And just look at this. It's brilliant. If muscle weakness makes it hard to grip things, A simple tool like this universal cuff can make all the difference. It lets someone hold a comb, or a toothbrush, or a spoon, and that simple act restores so much dignity and independence to their daily routine.
It's all about solving these everyday problems. So, what if you can't hold a glass securely? Well, this simple little straw holder just clips on, making it possible to have a drink without any help. It's these small innovations that have a massive impact on a person's quality of life.
Even just re-engaging with the outside world, like opening the door to your home, can become a challenge. An enhanced grip key holder makes that possible again. See, occupational therapy is all about empowering people to overcome these physical hurdles and get back to living.
And this brings us right back to where we started. We've established that the bacterial infection can be cured, the physical challenges can be managed, but that leaves us with one final and formidable enemy: the stigma.
One of our sources defines this perfectly. Stigma isn't just a bad feeling. It's being, and I quote, disqualified from full social acceptance. It means you're being judged not for who you are, but for a medical condition you have, often leading to total rejection by your own community.
And that has a profound psychological impact. I mean, if society is constantly treating you like an outcast, it is so easy to start believing it yourself. This can lead to a really devastating loss of self-confidence and this feeling that you're somehow less than whole.
And this, right here, is the modern tragedy of leprosy. We have the medicine to kill the bacteria in a matter of months. What we don't have is a pill that can erase the psychological wounds of being shunned and feared and isolated. Those scars, they can last a lifetime.
So, I'll leave you with this question. We have pretty much conquered the biological disease. The real challenge that's left isn't medical, it's social. The bacteria can be eliminated. The real question is, can we eliminate our own fear and prejudice? That's a question for all of us to answer.